Ambarish Pandey and Mike Gibson coming to you live from ACC 2026, and we're talking about the Fund Heart Failure Study. Talk to us a little bit about what you did, Ambarish.
Yeah, thanks, Mike, for having me to discuss this important study. We did a randomized control trial of financial support among patients who are socioeconomically disadvantaged and had a heart failure hospitalization. We were doing this at the safety net hospital called Parkland Hospital in Dallas, Texas, where I work. And in this study, we basically included eligible participants that had a household income less than 130% of the federal poverty level. So they had a lot of socioeconomic distress and were hospitalized with heart failure. And at the time of discharge, they were screened and they were invited to participate in the study. And the two intervention arms were upfront financial support of $500, which is around 80% of the median income of the study population versus a delayed support after 4 weeks. And the study duration was for 4 weeks, looking at two key endpoints of medication adherence measured by serum drug levels of
Mm,
cardiovascular medications and quality
hmm
of life. And this is a
hmm
pilot study, so we did a 4 week follow-up, and then the idea was to see if financial support can improve meaningfully medication adherence, access to care. We did not tell the patients what to do with the money. We gave them a debit card that was had the money, and we also tracked how they spend the money. We were able to ask them and also check through the debit card expenses. And so that was the study design. What we found was that individuals who were randomized to upfront early financial intervention, financial uh, support had meaningful improvement in adherence measured by serum drug levels of the cardiovascular drugs, including heart failure therapies. So these patients were taking these therapies more than the group that did not get upfront financial support. We did not see a meaningful difference in quality of life, however, and this was a 4 week study, so we didn't probably have enough follow-up duration to have meaningful changes. But the finding of improved adherence was encouraging, and that is informing our larger trial design that we are working on right now.
Ambarish, can you give us a sense of the magnitude of improvement or difference in terms of adherence?
Yeah, so we did see a meaningful difference in the adherence of the tested medications. I think it was around like 20% greater adherence if you look at all tested medications which were positive on the serum drug level test versus not. So there was a significant improvement. We also looked at it in different ways. We looked at the probability of complete adherence to all the tested medication, and there was a 42% higher probability of complete adherence relative to in the compensation arm versus the arm that did not get the financial support. So we did see a pretty meaningful and I think moderate to high magnitude of improvement.
Wow, congratulations. I look forward to your next more pivotal study. This looks like a great start. Thanks for joining us, Ambarish.
Thank you so much.